Welcome everyone to this special session on psychedelic-assisted psychotherapy, and we have with us Dr. Anthony Bloch from Australia. He's a rural generalist who is trained in psychedelic-assisted psychotherapy, and he has worked as a flying doctor in Royal Australian Flying Doctors and Aspen Medical, and he'll be talking to us about psychedelic-assisted psychotherapy. So nice to have you, Anthony.
Lovely to be here, Divyam. Thanks for the invite.
Yes. So before we start, I would like to ask you a basic question about the psychedelics. And I just wanted to add that the co-organizer of this meet, my colleague, Dr. Bhavya Bhansali, is with us. Yes, we can have.
Hi, nice to meet you, Doc.
Pleased to meet you, Anthony.
You too, man.
It would be, first of all, it would be very exciting to hear about psychedelic-assisted psychotherapy from you. So I would start by asking you to take us through the journey of this psychedelic-assisted psychotherapy.
When you say the journey, you mean the anatomy of how it all works, how a patient moves through the process, or how it came to Australia?
Yes, the idea, the basic idea of how this therapy goes through and about the sessions.
Okay, so psychedelic-assisted therapy is a novel therapy. In some ways, it's been researched since the 50s. That research stopped when the American government banned it. And it's been resurgent there's been a renaissance since the 2000s. And the basic premise of psychedelic-assisted psychotherapy is that the psychedelics allow for the ego mind to be loosened and for the ego, in some cases, to be switched off completely. And that reframes how people view, well, everything, essentially, the world, the universe that they live in. And that reframing allows for a neuroplasticity, a new way of thinking about your life and the troubles you might have, and your place in the world or place in the universe. And that insight lasts after the medicine wears off. And if you do the work afterwards, those insights can form a lasting change and a reset and reframing of your situation. And that's where the magic really happens with psychedelic-assisted therapy. The process of it is quite rigorous. There are dangers in choosing the wrong patient. There are dangers in doing it incorrectly, and there are many different facets that need to be done right for the treatment to be fully effective. So I'll take you through sort of how a patient journey would work, if that's what you'd like to know. So the first thing is, in Australia, it's legal only for treatment-resistant depression for psilocybin and for PTSD for MDMA. So those are the only two conditions that we're allowed to treat legally in Australia. All right. There are going to be more that will come in. The evidence is building for a number of other conditions, such as existential grief if you've been given a life-threatening diagnosis, anxiety disorder, and others. But for now, that's all we can do. So we need to screen patients very carefully. Some patients are suitable for psychedelic-assisted therapy, some are not. And it really comes down to the patient, how they are able to interact with therapists, how they're able to connect, how insightful they are, what their social supports are back home, and a bunch of other things. And once the patient's been screened, then they are prepped, and that preparation can take anything from 3 to 5 hours or longer. And it's really taking them through all the possibilities that they might encounter, as many as we can predict. Remembering that we're going into somebody's subconscious and we can't really predict what's going to come up for that particular patient. So not only can we not predict what's going to come up, but the experiences are so esoteric and so ineffable that often we can't describe to somebody what's going to happen. So consent is a big issue with this. And we can talk more about that if you like later. And once we've prepared the patient, we've told them what's going to happen, we've gone through their psychosocial history, obviously, so we have some idea of what might come up in the therapy. We'll take them to the actual room where the therapy is going to happen, show them what it looks like, where the bathroom is, as many of the details as we can, we prepare someone for. We'll prepare them for some difficulties that they might encounter, how they might traverse those difficulties. And then the day of the dosing session, it's usually for psilocybin about a 4 to 6 hour session. They'll come in the morning, usually have some kind of a little ceremony, and it's obviously a secular ceremony, but people can bring items of interest into the room with them to make them feel more comfortable, or items that might provoke them to have a deeper journey or to feel more comfortable. That can be anything, photographs of friends and family or loved ones, items, flowers, whatever. And then we sit with them for the 4 to 6 hour journey, and it's variable with people. There are many more people more skilled than me and more experienced than me at doing psychedelic therapy in Australia. But the journey is never predictable. And our job as psychedelic therapists, unlike what all you mental health folk go through with training, is very much a non-directive approach. So we don't like to make conclusions or to draw conclusions from people's experiences. It's really important that we allow them to draw whatever meaning and conclusions they can find from the therapy. And then after the medicine session, there's a period of integration. And this is really important because the experience that these people have is quite profound often, and quite complex and quite difficult to make sense of and difficult to speak of. So the integration will take however long it takes. Again, it can be up to 3 to 6 hours worth of sessions afterwards. And that's really about exploring the experience with somebody and getting them to talk about that experience in all the other modalities other than necessarily narrating the things that they've discovered or the things that they've experienced. So it might be artwork, it might be music, it might be somatic work. How do you feel in your body? And later on, we'll get them to give more of a narrative experience. And that's because words are so limiting when it comes to experiencing and to describing these experiences. We want people to be able to describe them in many other ways using right brain and other inputs as well. And if the integration is done right, if the patient's been well selected, if the therapy has been well conducted, there's quite a high chance that people will have a transformative experience of one kind or another. Whether that leads them to a cure or remission from their mental illness is variable, and it does depend on doing the work afterwards. But most people will come away with at least the start of a journey of healing, if not a transformative healing experience in itself. Anybody got any questions about that? Have I covered the topics that you were interested in?
Thanks a lot, Anthony. Since it's a very new topic and it's still in the developing stages, I'm not sure what about in India. Yeah, definitely. Like as a psychiatrist in Australia, I have never experienced psychedelics. I do come across a lot of patients with medical cannabis, and I've got a bit of idea about medical cannabis, but definitely not about psychedelics. Moreover, I'm ADHD expert, so I do come across all these things. So I would be more interested in what exactly psychedelics do you use? In what form does it come, and how the patient is prepared, and what's the exclusion criteria, and like what's the total course of the treatment, and the general stuff which will be I
Sure.
think more beneficial to the students as well as a general idea.
Yeah. Because it is really important when you're speaking to your patients that because people will come to you asking about psychedelics often as it becomes more well known in the mainstream. And it's really important that you temper people's expectations, because unrealistic expectations are really one of the issues that people encounter. And if psychedelics are being promoted as this miracle cure, and then somebody has a psychedelic experience and isn't cured, it makes them feel even more hopeless and helpless. So tempering expectations is really important. Patient selection, I'll talk to you about first, Sanjay. And really, in Australia, it's very prescriptive, right? So it's treatment-resistant depression. And really that means it's a pretty low bar, really. You have to have had two treatments for depression over the period of 6 to 12 weeks and have failed those treatments. So it's not a long-term treatment that you had to have gone through and failed to be eligible for psychedelics. So that's a good thing. As far as patient selection goes, there are a couple of things that are unfortunately realities in Australia. And the first is cost, as you mentioned. This is a treatment for rich people. That's just the way it is at the moment. And it's really unfortunate because obviously most of the people requiring these treatments are people that probably can't afford them yet. So because of the number of therapy hours, and you're talking about a preparation, the day of medicine session, plus the integration with 2 therapists, those costs mount up. So you're looking at sometimes, up to sort of 120 hours in total of therapist time. At the moment, treatments in Australia vary from about $15,000 to about $25,000. It just depends on the clinics. So it's a significant cost. But we are hopeful, and it's starting to happen already, that some costs are being covered. So some of the medical insurers are now starting to fund psychedelic-assisted therapy. Some of the first responders and the military are starting to fund psychedelic therapy for PTSD for some of their veterans. And we're hoping that ambulance and police services will follow next. I reckon it will be 10 years or more before Medicare funds this. They'll need to have a robust set of data proving cost effectiveness, right? So that's the cost issue. From the psychosocial perspective with patients, we really need patients who are able to engage with therapy, who've proven they're able to engage with therapy, that have some insight, that are able to muster some insight. That's really important. People who dissociate are problematic. If depression is linked with things like bipolar or other psychotic illnesses, that's a contraindication at the moment for psychedelics, as are things like narcissistic personality disorder, borderline personality disorder. Those things are problematic because of the lack of insight. So those are exclusionary criteria. Then we come to the sort of psychosocial supports, and people really need to not be at rock bottom. They need to have a stable environment, preferably have a stable social environment where they're not isolated, they're in a relationship, or they've got family. Preferably they're still working. We find that people do better. Those sorts of people do better because the social supports afterwards are really, really important. So those are the sort of main exclusion criteria, right? We're looking for people that are reasonably well functioning and have those fall in those diagnostic categories. And then we're still got to prepare them and go through that preparation session and have them screened by the authorized prescriber psychiatrist to see if they do meet the criteria for treatment. Was there anything else you wanted to know about that, Sanjay? Great.
Thank you.
I had one doubt, Anthony, that is it appropriate to call it psychedelic-assisted therapy or psychedelic-assisted psychotherapy? Because when you are conducting sessions, do you also conduct, is it a psychotherapy or is it just the therapy?
So that's an interesting one, Sanjay, and both are used. I think that mental health experts that are raised in a psychotherapeutic background feel more comfortable calling it psychedelic-assisted psychotherapy. And people like me without a mental health background are more comfortable calling it psychedelic-assisted therapy. Now, I don't really mind either term, but what we need to be mindful of is that it's not traditional psychotherapy. If we're going in there and leading a patient to conclusions or to insights, as would traditionally occur in traditional psychotherapy, that's not the way psychedelic-assisted therapy works, and that can be detrimental to the outcome, simply because this is such a personal experience, and people really need to come to their insights themselves. So what we do really during the session is we are really providing a space where we have prepared someone so that they feel completely safe and nurtured and supported to be able to experience fully anything that comes up, to not be embarrassed about things that come up, because within a deep psychedelic experience, there are some strange things that come up. People can have orgasms, for example. So people need to feel very, very comfortable and within that container, what we call sort of the therapeutic container on the day and throughout the entire process of psychedelic-assisted therapy, from preparation to post-integration. We hold a container that's very permissive, and anything is welcome. It doesn't, there's no shame, there's no judgment, and people really need to be able to feel that experience deeply. We don't tend to psychotherapize a lot. MDMA is a bit different because there's more talking with MDMA. So psychotherapy is used more in MDMA than it is in psilocybin-assisted treatment. So yeah, you can use either, as long as you have that in your mind that this is not the normal psychotherapy that we do. I know mental health experts have to actually retrain themselves in some ways to be less directive.
So in a particular PTSD or major depression, like, is there any guidelines how many sessions you have to go through, and then how come it becomes different from EMDR, and how come it becomes different from normal hypnosis with transit state, and that sort of, doesn't it look like it's
Sure.
same?
So it's interesting. I actually find the intersection of hypnosis and psychedelic psychotherapy really interesting, and I think that's going to be a place for more research in the future, because I think hypnosis could really help to deepen and relax people within the in the medicine session. It differs from those treatments. I guess it's hard. Psychedelics are a fundamentally different treatment. As doctors, we understand the medical model of treatment. As psychiatrists, you give someone medication, it has an effect. In psychedelic medicine, if you gave somebody a psychedelic, you didn't prep them, you put them in a fluorescent lit room, which is what happened in the early days of treatment. You put them in a fluorescent room, close the doors, leave them to have their experience, that they won't get better. They'll have a very difficult and challenging experience. So the medicine of psychedelic-assisted therapy is the preparation, the relationship with the therapist, as it is in most forms of therapy. The relationship with the therapist is very important. It's the environment. It's the room that you put them in on the day. Is that a relaxing, nurturing, welcoming space? And then it's the music. We play curated playlists through the psychedelic session that follow the trajectory of the drugs and are very specifically designed to allow the brain to let go of rigid patterns of thinking. So the music, if the music is wrong in psychedelic therapy, that can also fuel a treatment failure or an inadequate treatment. And then the integration space afterwards, really important. And even after that, going back into their community, into their environments, into their home. In Western culture, we've lost our psychedelic culture, right? I mean, we had it all through Europe until the Romans burnt down Eleusis in Greece, which had a 2,000 year history of psychedelic-assisted therapy for all of its, or psychedelic experiences for all of its population. So when someone comes home now to a partner or friends, they have no context to understand what's happened to this person. And that can be quite isolating for somebody. So in Australia, we're starting to use, and this is really interesting, we're starting to use sort of some of these underground psychedelic groups who provide group integration sessions. So after we've done our integration for a couple of months, we'll send them to one of these underground groups. Some of the clinics are doing this. When I say underground groups, we're working with people who have psychedelic experience in the community and plugging them into these community groups so that they can have a support network really important, again, to help solidify the experience and the changes that we hope to see in people. So it's very, very different to other forms and other modalities. It's different to ketamine therapy, and certainly different, in some ways, different to hypnosis, just in the way it works in the duration. But it is also obviously a trance state where the ego has been released or reduced, and people are free to access their subconscious.
In many states of India, especially when we go to Kerala and in northern part of India, like Haridwar and Kashi and all these places, Rishikesh, they've got a lot of, not for ashrams, which we call, and they're basically meditation center where you are being detached from the outer world. They even take your mobile and all that, and you can spend 2 weeks, 3 weeks there with their therapies, which includes everything, including food, diet, nutrition, massage, and Ayurvedic therapy, plus meditation and some relaxation and some religious things, some meditation. So I think it's one of the modernized form of that sort of therapy which we have been doing. Do you agree with me, Divyam?
Look, I think that's a very interesting kind of treatment modality, and India has a long history of meditative practices and spiritual practices, as well as psychedelic practices. In your soma was a psychedelic brew, most likely. And it's interesting because what you experience in these retreats that you're talking about is in some ways very similar to psychedelic-assisted therapy. And remember that psychedelics were given, for example, to Indian advanced practitioners and other advanced practitioners throughout Asia in experiments in the US. And essentially what these advanced practitioners said is that the experience of a deep psychedelic trip is almost identical to a advanced meditative practice. So remember that with psychedelics, we're really shortcutting to actual deep, long-standing spiritual work. And the intersection of psychedelics and spirituality is a very, very close one, to the extent that really in modern medicine now and psychiatry, which is a very, as you would know, a conservative profession, we're really starting to have to use the words sacred and spiritual when we talk about psychedelics. One of the early practitioners in psychedelics, his name escapes me now, one of the early psychiatrists, he created a questionnaire to try and figure out what could predict if a good effect in psychedelic-assisted therapy. And it was the mystical experience questionnaire. Now, he drew up a list of questions to try and elucidate how deep a mystical experience somebody had. And it's difficult because these are ineffable experiences, but there was a whole lot of questions about all sorts of kind of things, like time moving differently, inability to express in words the experience. But what was found and what was validated was that the deeper the mystical experience, the more likely somebody was to be cured of their mental illness. So what we're inducing, and make no mistake, what we're inducing is an experience that does happen if you practice meditation or meditative practice for many years and are able to reach a deep meditative state. It's the same experience.
Over to you, Divyam.
This is getting very interesting, Anthony. So we are half an hour down. So can we do it for half an hour more? Because
Sure.
I talked to you about 45 minutes, but I think we'll be overstepping the time.
No problem. Happy to chat.
So I would again go to that question of psychedelic-assisted therapy versus psychedelic-assisted psychotherapy. And so what is the role of the therapist here? Because from what I get to know from your answer is that most of the thing is being done by the patient and not by the therapist. So it's not a psychotherapy in the traditional sense. So why do we need two therapists?
So that's an interesting question. And I think, again, that people who are trained in psychotherapy are very keen to use their psychotherapeutic skills in psychedelic-assisted therapy. And you'll get some argument about this and about the role of traditional psychotherapy. And in Australia, we've recognized that a trained psychotherapist is essential in the room to provide safety, okay, in this early stage of this treatment. And certainly trauma-informed and other forms of psychotherapy, especially things like internal family systems, are really useful in psychedelic-assisted therapy. They really help to explain some of the things that are happening to people. And it's a good way for patients to have that explanation and be navigated through some of those things. But again, yes, it's a much more passive process, a much more passive process. So in Australia, legally, the requirement is for one of the people in the room to be a trained psychotherapist. The other person in the room, and also obviously trained in psychedelic-assisted therapy, the other psychedelic-assisted therapist in the room doesn't need to be trained in psychotherapy, but is somebody who's had psychedelic-assisted therapy training and is usually a person who's involved in healthcare. So that can be a mental health nurse, a doctor like myself, a paramedic, even pastors, religious pastors are trained in some of the courses. So people who are used to providing care to people, not just someone off the street who's interested in psychedelics, because it does take a little bit more of a therapeutic presence in the room. But yes, in psilocybin, really the patient is encouraged not to talk during the medicine session. And if they, and the patients are laying down on a couch, they've got eye shades covering their eyes, they've got headphones on their ears with the music playlist playing through the headphones. So they are really, really isolated and internalized. And it's a different experience. If you even take your eye shades off, even in the deepest part of a psychedelic experience, that experience changes completely. It's a completely different experience, even just opening your eyes and looking outside. So people who've taken psychedelics recreationally will go, oh yeah, I've taken psychedelics, I know what it's about. No, you don't. In psychedelic therapy, when you're completely isolated and you've not got any external references, your brain goes completely internal. This is a very, very deep, powerful, and different experience. But people sometimes want to take their eye shades off and speak about what they've just experienced, and that's fine. But we encourage them immediately to go back into the experience, to carry on with the experience. In MDMA, it's a bit different. MDMA, it's not a psychedelic. There's some argument about this. It is not a psychedelic. What MDMA does is it really allows people with PTSD to both remember their index trauma, often in more detail than they could usually. But more importantly, it allows them to speak about and think about their worst index trauma in a way that is safe for them. The medicine cushions all the somatic responses, all the autonomic responses that they'd normally feel when they talk about their trauma. So they are cushioned by the oxytocin release and the serotonin, the dopamine release of MDMA. And it is the perfect therapy drug. So the reason that people are be able to be cured in quite high percentages from PTSD is not that they have some revelation, it's that they're able to engage in the psychotherapy and talk about their trauma without becoming overwhelmed. And what people with MDMA talk about is that they were able to remember their trauma and to speak about it. And then those memories are put back in a way that is no longer confronting or damaging to the person. So that traumatic memory becomes simply a memory. Okay. So there's a lot more talking in MDMA. It also lasts a lot longer, 8 to 10 hours, as opposed to 4 to 6 hours with psilocybin. And there's certainly a lot more psychotherapeutic skills required with MDMA than there necessarily would be with psilocybin. If that answers your question there, Divyam. You guys are muted still. You got to unmute. There we go.
Yeah, there we go. Thank you, Anthony. I have 3 more questions. I will try to keep it short. The first one is that after a typical session of psychedelic-assisted psychotherapy, is there any follow-up session? And if there are any follow-up sessions, then what is the workup done in those sessions? The second is that what are the breakthrough moments that the patients report during the session? And what is the role of music? I mean, what kind of music do you choose, or is there any particular kind of music, or is there any particular kind of modulation that you do during the process? Thank you.
Sure. So I'll try and remember those 3 questions, but I might ask you to repeat them. So the first one was around the follow-up. So when I spoke about integration, that's the follow-up. So after the sessions, the next day, there'll be a little bit of talking on the afternoon of the session, just to make sure people are okay. They might do a little bit of artwork to maybe draw something from their experience. We don't want them to talk about it. We don't want the cognitive brain engaged too early, and we don't want a verbal narrative engaged too early. Because when you look, for example, at a gorgeous landscape scene, you're sitting in the mountains somewhere in India and you're watching a sunset and it's indescribably beautiful, right? As soon as you say, oh, this is such a beautiful scene, then that whole experience is contracted into the word beautiful. And beautiful doesn't cover the experience that you've just had in this beautiful environment. So we try not to use words to describe it too early, because that limits and narrows how the experience is carried. We want that experience to be carried in all the senses, in the somatic experiences in the body, in the feelings that somebody had, the emotions that were raised, things they heard, things they saw, and stuff like that before we start to narrativize it. So those integration sessions will start maybe the next day, and they will go for as long as is needed. In the trials, it's usually only about 3 to 4 one-hour sessions, right? And what we're essentially trying to do is to try and explore every aspect of that person's experience, so that they can internalize that experience in a very complete way. And then by doing that, they're able to learn the lessons of the new insights that they've had, and be given skills and ways to integrate that then into daily life. And the integration process goes, it can go for more than a year, and it's very subtle. While you might have had this transformative experience, you'll notice a change maybe 9 months down the line, where you'll go, oh, wow, I reacted differently to that experience that I've just had than I would have 9 months ago. And it's a profound difference, but you haven't really noticed it because your brain has been, and this is the neuroplasticity part of psychedelics, which we haven't really spoken about yet, because your brain is slowly rewiring. If you do the work, your brain is slowly rewiring to a new way of thinking, a new way of thinking about the world, a new way of thinking about yourself. And as those new pathways become more ingrained, your thinking changes and you change. And it can be very subtle and go on for a long time. So that's the follow-up part of it. Now, what was the second part of the question?
So yeah, thank you, Anthony. The second part was that what are the common breakthrough moments that the patients report?
Okay.
And have you encountered any patient who has had the post-session psychotic breakdown, or during the session, if a patient has had a psychotic breakdown or not?
Okay. So as I said, there are a lot more people, a lot more experienced than me in doing the therapy in Australia. We find that with the psychedelic-assisted therapy done in this very careful, controlled way, there are almost no episodes of permanent psychological harm. So when you talk about a psychotic experience, essentially that's what we're introducing. I mean, we're inducing a hallucinatory experience. So the whole experience is a psychosis. But if you're talking about something that's so distressing that somebody becomes agitated or violent or unable to cope, Yes, the violence less so, much less so, especially with proper patient selection. But the overwhelming experience where somebody is just emotionally absolutely at their limit, experiencing things that are confusing to them, that are dark, that are frightening, that they can't understand, that are completely confronting, that absolutely happens in psychedelic assisted therapy. And without trained therapists in the room, those are the experiences that would be described as a bad trip. Unresolved, difficult experiences that somebody was too confronted to actually move through and break through. And if they're unable to do that, that can stay with them as a bad trip. And that can be a prolonged and profound psychological harm to someone. That really doesn't happen in trained psychedelic assisted therapy. And with all the trials over the many years, that's a very, very low risk. However, and what we do with these very, very difficult experiences that people have is, again, we're not telling them what to do. We're reminding them of the preparation that we gave them. We might provide therapeutic touch as a way to help ground them. Touch is a fascinating discussion in psychedelic assisted therapy because the consent around touch is very, very interesting. And for mental health professionals, touch is this like taboo thing. Of course, for us doctors, we touch our patients before we even say hello almost when I'm seeing people in the emergency department or whatever. But it's a very problematic thing for mental health professionals who are often told don't touch, don't hug, don't, because that's a boundary violation. But touch is a very, very profound treatment modality within psychedelic assisted therapy. So we help people through those difficulties really by telling them you're safe, nothing bad is going to happen, you've got this, you have the tools to work through this. Remember what we spoke about. Some therapists, some of the famous therapists would say, for example, if you see a dragon, if you see a monster in psychedelic assisted therapy, be curious, ask it, why are you here? What are you here to teach me? Bill Richards, who's one of the founders of psychedelic assisted therapy and just a wonderful, wonderful human being, tells his patients, dive into the eye of the monster and look out from its eyes. Okay. So we have these little tricks and tips for people who are undergoing a really, really confronting experience. And if they're able to be curious, to be brave, to be bold, and to trust themselves, trust the therapists in the container that's being held for them, that they're going to be safe, that the only way out of this experience is to go through it. All right. Then often we find that these really difficult experiences, the challenging ones where you're crying your eyes out and sobbing and scared and confused, if you break through that, people describe a breakthrough to a blissful, joyful, light-filled experience. And that's essentially a psychic trauma that's been healed right there. Okay. So that's how we help people through those things. The long-term effects of things we've heard about, this persistent psychedelic disorder, flashbacks, that sort of thing, very, very rare, very, very rare. People do go through other sorts of negative effects from psychedelics, and that is expected. And that can be quite troubling. It's things like depersonalization. After an experience, people might not think that they're real for a while. It can go on for days or weeks. A derealization, people might not think that what they're seeing around them is real. They might think they're in the Matrix, for example, because they've had this peek behind the curtain, and coming back to the real world is quite difficult sometimes for some people. So there are a whole bunch of things that people might go through afterwards that are expected difficulties with psychedelic assisted therapy. But really, for most people who do it in the therapeutic, controlled, legal way, we can minimize a lot of that. Now, as far as transformational experiences go, I mean, the stories are just beautiful, beautiful. One of the big things that psychedelic assisted therapy does, or let me start this way. With depression, for example, the biggest symptoms for people with depression are, feelings of worthlessness, but feelings of disconnection, and feeling of obviously not being loved or not being able to love. And these are the fundamental issues that some would say form the basis of mental illness. So if you want to break down mental illness in a particular paradigm, you could say that the psychological woes of modern man are really due to his disconnection from self, right? Disconnection from our sacred soul, if you want to talk about it in that way, but our sacred essence that always remains constant, that's always love, that's always connection. And when we disconnect from that, it makes us unwell. And we disconnect from that for a number of reasons: trauma, upbringing, genetics, and personality, that sort of thing. So what psychedelics do is that they completely, if you look at the ego as a lens by which we see the world, okay, that lens is not only a focusing lens, so that lens only allows us to see what we are programmed to want to see. And what we want to see is personality, genetics, background, trauma, all those things. So not only does it screen us from things it frames the world for us in a way that we've essentially told it to, right? But not only that, it also colors what we see. So it's a colored lens, and it colors what we see. That's why one of the examples I give is the because I'm Australian, the Crocodile Dundee movies. I don't know whether you've watched Crocodile Dundee, but he's an outback Australian, goes to New York, and he gets attacked by a group of young men with a little flick knife, and he's with an American. And they come at him with this knife, and he just laughs at them, and he says, "Oh, mate," he says, "that's not a knife." And he pulls out this big knife, and he says, "This is a knife." And when his friend says to him, "Weren't you scared?" he says, "Nah, just a couple of kids out having a good time," right? So that's how he viewed that interaction, whereas other people view that with fear and concern. And that's because of where he's come from and the lens with which he views the world, all right? And there are a million examples you could think of how two people can view the same thing and have completely different take-homes from it. That's our ego, framing what we see and telling us what it means, okay? When you disconnect the ego, and the psychedelics work on the 5-HT2A receptors, some in the seventh layer of the cortex, but they work mostly in those receptors in the default mode network. So all of those areas of the default mode network are essentially the correlate of the human ego, and they can be completely switched off. And when you switch the ego off, most people view what they see in a very similar way. And that is a universe where time doesn't exist, a universe filled with love, a place where you are, when your ego boundaries completely dissolve, you dissolve. It's a death. Your body dissolves. We are told we end where our skin ends, right? That's the end of us. That's where we finish. Psychedelic-assisted therapy, that boundary dissolves. And you are one with the raindrop, with the rock, with the leaf, you are the same, all right? So it's a profound sense of connection. But there's also, with everybody, this profound sense that they are loved and that they are worthy of love. Some people see a creator, some people will see Jesus, some people will see the Buddha. It depends on your background. Atheists might see God, which really pisses them off. But that's one of the dangers that we say to people: look, your tightly held beliefs are going to be shaken. You need to be aware of that. So people have this profound, what we call unity experience, where they expand into the universe in some respects. And that experience is remarkably consistent. And it begs the question, is what is real? Is our waking life real? Our ego telling us we're creating what we see. We know this. Nothing is real. It's just what we create. We don't know anyone else exists. Or is it the experience under psychedelics where your ego lens and coloring is completely removed and everybody seems to see the same thing? Is that real? Anyway, so as far as transformative experiences go, that's the big one. And that really allows people to reframe their value, their place in the world, their place in the universe, their feeling of connection, their feeling of love. But as far as sort of anecdotal transformative experiences go, it's beautiful. For example, we did a trial here on existential fear of death. It was a lovely psychologist called Dr. Margaret Ross and Justin Dwyer as a psychiatrist. And one of the stories that I remember from that is a woman who had lost her husband, and they'd had a beautiful marriage. And then she got unwell with cancer, and she'd really never been able to get over the loss of her husband, and she'd stopped living. And when she got a diagnosis of cancer, she really cut herself off and stopped living. And in this psychedelic experience, she saw her husband, and they would go out dancing a lot, her and her husband. And she danced with him within the psychedelic experience. And they had a beautiful sex life. And she had an orgasm within that psychedelic experience and was able to farewell her husband in a way that she'd never really been able to before. And after the experience was able to live her life again, went out, went dancing again, engaged socially again, and was completely transformed in that way. So people have these beautiful experiences. They can resolve issues with dead relatives or dead loved ones that are intensely real to them in a way that's intensely meaningful. So people have these incredible breakthroughs. And even if they aren't cured of their, for example, depression at the end of integration sessions, they are started on a journey of understanding that has shown them a different way of feeling. Now, the neuroplasticity occurs in that moment of ego dissolution where you're able to think about things in a completely different way. And if you maintain those thoughts, then those neural pathways will grow and follow and solidify those changes. But there is also a pharmacologically driven neuroplasticity in that psychedelics stimulate BDNF, which stimulates neuronal growth, so brain-derived neurotropic factor. And it actually stimulates neuronal growth. So the thought is that if you do your integration well, you're not only aided by your new insights, but you're aided by the psychedelic stimulation of neuronal growth, and you can move the pathways. A very quick analogy: if our thoughts are like trickles of water on sand, then the more we think, the more those trickles on sand make those rivulets deeper and deeper, the more likely our thoughts are to move in those same well-worn, well-understood channels, right? And that's what we do as adults. We shortcut our thinking because of what we anticipate we're going to understand, and we solidify our thinking, especially as we get older. What psychedelics do is they wash that sand completely flat, and your thoughts are now free to form any new pathways that you want. So that's the transformative. And I'm sorry, there was the third question to that. Can you remind me what that was? No, you're muted again.
Yes. So the third question was about the music that you play. So what kind of music is it?
So the music is fascinating, and people have done their PhDs on music. There's a guy called Mendel Kalen who worked with one of the Americans. I think it was Monash. No, I'm not sure. Anyway, he's written a PhD on the music of psychedelic-assisted therapy, and he could go into the textures and the beats per minute and the context of the music. But essentially, what the music needs to be, or the music shouldn't be music that's recognizable. You shouldn't be able to predict the next chord or tune, or if there's vocals, it's usually vocals in a foreign language. You shouldn't be able to predict it, and you shouldn't be able to identify with the music. What the music's there to do, and it's a profound modality. I can't explain deeply enough what the difference is between doing this experience with music and without music. The music is essentially your guide through the experience. It starts off relaxing to calm you. As the experience builds up with psilocybin at the sort of 1 to 2.5 hour mark, where it's really intense, the music constantly reaches crescendo and takes you to a point where you could release and then drops back again. The music invites you to let go in that experience. And quite often the music in that part of the thing can be quite intense. And it's supposed to provoke that release and letting go and being free to let go. And then in the latter stages, the music becomes a little bit more serene and allows gentle insights to happen as the big ego dissolution experience wears off. There's many, many insights that people get and many just beautiful transformative thoughts that people have in those last couple of hours. And the music then reflects that in a more gentle, welcoming sort of beat and tone. So if you want to look on, for example, Spotify, you'll find many different psychedelic playlists, and they're curated through the experience. Now, as far as changing the music in the middle of the session goes, we can do that. It's tricky. But we would say that if somebody's having difficulty with the music, we would first ask them to be curious about that. Why is this music challenging for you? Why are you feeling that the music is unhelpful? Have a little bit of a think about that. But if they're really struggling with the music, yep, we'll switch and change it. But it's got to be changed to music within that trajectory of the drug. So it's quite a complex thing, but mostly people stick with the playlist that are provided, and that playlist can then be provided to them later on for integration, to help with their integration. It helps them re-engage with the therapy. So I know you guys are interested in psychedelics as far as longevity goes, and it's a really interesting topic, because the longevity and wellness medicine in worldwide is becoming quite prominent. And what is it? Do we just want to live longer, or do we want to live better? And obviously people want both. But psychedelics fit into both reasonably well, in that obviously they can help in longevity. Psychedelics, I think, should be taken by everybody at least once a year, and at least when you're in a life transition. So when you're moving from man to husband, woman to wife, woman to mother, man to father, retirement, any big experiences in your life, psychedelics can be very helpful to prepare you for that new phase of your life, right? And it's also very, very helpful for creativity, for thinking outside the box, for rewiring the way you might approach problems. Scientists, chemists, computer scientists have used it. It's said that the computer chip wouldn't have been invented without psychedelics, because it really does just allow for that out of the box thinking. So one of the things that is happening worldwide now are these sort of wellness retreats, where people go to experience psychedelics, not because they've necessarily got a mental illness, but remember that we all carry a little bit of trauma through our lives. No one comes through life unscathed. We all have a little bit of bark knocked off us as we go through life. So there are many of these sort of wellness retreats, and in June I'm actually doing a retreat with a colleague of mine who's a clinical psychologist, and her name is Aileen Delgado, and we're doing a retreat in Portugal at a eco resort, and it's really for sort of high functioning people who are looking for that extra insight, that extra performance, if you like, in their work. And we take them through an experience over 5 days with 2 medicine experiences, preparation and integration. There's a chef, so it's all fresh food. There's a yoga teacher who goes through some of that sort of experience to help people deepen it. I'll post just quickly the link to that in the chat there if anyone's interested. But yeah, so we're providing that for 10 participants. There are a couple of places left if any of the people who watch this recording are interested in experiencing a psychedelic experience. It's not for people with severe mental illness. This is not the container that we're holding, but certainly, and we screen people beforehand as well. So if anyone's interested in that, it's a beautiful way to understand how psychedelics work. If you're planning on prescribing psychedelics or referring people for psychedelics, I would highly encourage everybody to have a psychedelic experience. And certainly psychedelic therapists should not be doing the work unless they have had psychedelic experiences, because it's simply not possible to properly support someone through an experience that you have no understanding of.
Uh, that was a wonderful overview of psychedelic assisted therapy. And from what I gather from what you have talked till now, I think you must have had psychedelic yourself.
Yes, absolutely have. Interestingly, there was a trial done in Melbourne for psychedelic assisted therapists. I mean, they called it a trial, but it was really a way to give psychedelic assisted therapists a psychedelic. So I got the synthetic version of psychedelic, and I know Sanjay asked about that. In Australia, psilocybin is given in a synthetic form. It's in a pill. It's 25 milligrams of pure psilocybin, which is equivalent to about 7 grams of dried magic mushrooms, which is a big dose, given that sort of a normal heroic dose of psychedelics for most people would be 5 grams of mushroom. But yes, I've experienced a number of different psychedelic substances in legal settings, and it's been a profound experience for me, and certainly I've been changed by it. Yeah, in both subtle and non-subtle ways.
While describing the experience, I think you sounded like a guru from India.
This is the truth. These are the same experiences. We are describing the same experiences. And the beautiful thing about psychedelic assisted therapy is that it gives us back that birthright of our spiritual nature.
We have a question from senior resident here in PDU Medical College, Rajkot, Dr. Bhumi Raval. She has asked that, are there any advisories or cautions for client post sessions?
Yes, there are. One of the things that can happen post sessions is suicidality. So people can become briefly suicidal after psychedelic experience, and that's almost normal. It doesn't happen with everybody, but it's a well-recognized thing. So that's the one thing that we just got to be cautious of. And we speak to carers and family, and obviously the patient themselves, and we make ourselves available, obviously, anytime, depending on our availability, or we would refer them to a after-hours mental health service if they are experiencing those things. But we do warn people about that. Some of the other things that I've mentioned, the depersonalization, derealization, those are transient effects. Very few people who go through the legal and properly trained psychedelic assisted therapy experience have long-term negative effects from it. But we will caution people about the things like suicidality and that they might feel a bit strange. We certainly say to people, no big life changes in the first 6 to 8 weeks. So no breaking up with your partner, no quitting your job, no taking on anything big in life. You really need time for these sands that have been washed clean to start forming new thought patterns and new rivulets. And baseline might take a year to return to a new baseline. So you might really be in flux for up to a year afterwards. You'll be functional through most of that time for sure. The first couple of weeks would be great if you didn't have to go straight back to work. So that problem of our culture not really understanding psychedelics, and people come out of this experience, they have their integration, they go straight back to work, straight back to a difficult marriage. It's not ideal, and straight back to a loving environment that has no understanding. And when they try to explain it, they can't, because words don't describe it. And that can be quite isolating for people. And that's why we make sure we try and plug them into long-term integration circles where they can talk about their experiences with other people who've had similar experiences. And so until Western culture regains its psychedelic knowledge and culture of these plant medicines, we need to be very careful about providing people that container afterwards.
One more question, Anthony, that have you experienced any client enter into a loop, or during the session, if the patient is not able to overcome any thought that they are having?
Yeah, so people run through all different kinds of mental difficulties, challenges in a psychedelic experience. Some people have just a blissful experience with beautiful awakenings and beautiful insights into their issues, but some people have very difficult experiences. And I'll tell you what one of the most experienced psychedelic therapists told me once. And she said she was in an experience once with somebody. This is Mary Cosimano from Johns Hopkins in America, a wonderful lady and a very humble, as most of these good therapists are, just very humble, grateful people. And she said she struggled for hours. This woman was just absolutely struggling, this patient, crying, emotional, unable to really cope. And Mary tried everything, absolutely everything, to try and get this person. And she was becoming upset that she couldn't help this person. And eventually she realized that a voice in her head went off and said, stop. You just have to keep this person safe. Just tell them that they're safe, that they're going to be okay, that it's a very, very difficult experience, but they've got the resources to go through it. They will come through it. The medicine will end and this experience will end. And in the meantime, I'm going to keep you safe. You're in a safe environment. And when she did that, she was able to settle her energy, which wasn't feeding the patient's anxiety more. The patient went on to have a very, very difficult experience, right, for the entire time, but had a transformative experience. And at the end of it had a very, very positive outcome. So sometimes people just have to go through these difficulties, and we're there to tell them that they can, that they have all the tools they need to keep themselves safe, and we will keep them safe. And sometimes that's all that's needed. It's very, very rare, vanishingly rare, for anyone to ever have to step in with medication to abort the experience. And it's not a great thing to do because you leave somebody unresolved.
Do we have some more time, Anthony?
I do.
Okay. So I wanted to ask about the legal aspect of psychedelic-assisted therapy in Australia, and what is an authorized practitioner, and how do you get a license for the same?
Right. So what the TGA did in 2023 was that they rescheduled psilocybin and MDMA to allow it to be prescribed by people who were authorized to prescribe it. Much like we went with medical cannabis in Australia, which people try and conflate the two, especially for the financial side of things. People get excited about psychedelic therapy for the money-making thing. You don't make money off psychedelics. But people have to go through an authorized process. Now, the only people that can become authorized prescribers are psychiatrists, and psychiatrists that have had psychedelic therapy experience. So they have to essentially, it's quite onerous. You have to essentially write a formal research proposal. So it's really difficult for people who are not in the academic sphere to write a formal research proposal. And I've got a couple of colleagues who are helping psychiatrists do this. Monica Schweikel, who runs a business called the Psychedelic Consultancy, she gave the first ever legal dose of MDMA in Australia, her and her colleague, Ted Cassidy. She's now started a psychedelic consultancy. She does therapy as well. And that helps psychiatrists move through that very difficult process of writing this very complex research proposal. Once they've gone through that research proposal goes through a human research and ethics committee. And there are many of them around the country associated with hospitals or otherwise. And once they approve that, it goes to the TGA, and the Therapeutic Goods Administration has to then approve that person to become a psychedelic-assisted therapist. Not only do they approve the person, but they approve the location as well, where the therapy can be given. And that's a contentious issue at the moment because we would like more nature-based locations to be authorized, and they are slowly happening. So the authorized prescriber is then allowed to prescribe psilocybin. And that means that that doesn't mean that they necessarily give the medicine or even in the room on the day, but they're the gatekeeper, and they decide, they screen the patient, they decide if this patient can go forward with the preparation and integration work. And that patient could be referred, could be one of their patients, it could be referred by a psychologist or a doctor like myself. And the therapists who will end up in the room on the day is really determined by the psychiatrist. You know, he or she may not want to be in the room. It's a big time commitment. So often they won't be the therapists, and they will let the therapy be done by trained psychedelic therapists. Might be another psychiatrist or a psychologist and a second therapist in the room. But they are ultimately responsible for that patient. So that's what the TGA has done, is put the ultimate responsibility in the hands of psychiatrists, which is ironic because when they legalized it, the College of Psychiatrists literally ran around like headless chickens saying the sky was going to fall in for a couple of months, then convened a committee with one psychedelic trained psychiatrist and came up with a set of very vague and unhelpful recommendations, and then disbanded the committee. So certainly the College of Psychiatrists in Australia has been and remains out to lunch. They don't want to borrow it. The college as a college just do not want to be involved in the governance, training, or monitoring of psychedelic-assisted therapy. It's a real shame. It will change. And there are groups of psychiatrists at the moment who are very interested and have various chat groups and stuff that they convene on. But so that's the story with the legal aspects of psychedelic-assisted therapy. The patient has to be approved by an authorized prescriber psychiatrist. At the moment in Australia, there are probably been a bit more over the last little while. There's probably about 30 to 40 or 50 authorized prescribers. And we've seen maybe 100 or so, less than 200 patients over the last 2 years go through legal psychedelic-assisted therapy. So it's not huge because of the cost and because of some of the limitations on authorized prescribers and stuff. It's not been huge. So we've done it very slowly, cautiously. Most people are doing it very respectfully. And at this stage, we've had no reported negative effects.
So you talked about the cost of psychedelic-assisted therapy. So is it covered in insurance?
So recently, some of the medical insurers have stepped up. There was a medical insurer first in Western Australia, I think it was HIB, that originally wanted to start funding, and I think now Medibank is funding, and one or two of the others are funding. And then the DVA has started to fund MDMA for its veterans. And some of the ambulance services in some parts of the country are starting to fund for their employees. And I'm hopeful that around the country, both our ambulance services and our other first responder services, including police, will start to fund for their employees, because there's a really high burden of PTSD in first responders and the military.
I also heard about the concept of vicarious trauma. So if the patient is releasing the trauma, if the patient is venting out, what are the effects of it on the therapist who is in the room?
I think it's the same with any psychotherapist, Divyam. And when you're doing psychotherapy, you're trained very much in avoiding some of that psychic transference, if you like. And it's the same with psychedelic-assisted therapy. You're hearing people's trauma, and it's no different for the therapist than it is in normal psychotherapy. I would say, again, I'm not a trained psychotherapist, but from my understanding, it's the same. You're not drawn into their trauma any more than you would be. We've still got that therapeutic distance, if you like, although we try and be much more humanistic in psychedelic-assisted therapy than we would be maybe in normal mental health psychotherapy, where there is that sort of more professional kind of detachment. In psychedelic-assisted therapy, it's more valuable to be more humanistic with your patient. But yeah, no, I don't think that that's a particular problem for psychedelic-assisted therapy, Divyam. You're muted again.
So there's one more question from Dr. Bhumira.
Sure.
That are they allowed to share or verbalize the experience to family members just post session, or are they advised not to share before the follow-up session is taken?
Look, we do advise them to try not to narrativize this experience. So they obviously are going to talk to their loved ones about it, and it will be vivid in their minds, certainly in the days, on the day and days afterwards. What we would say to people is try not to describe the experience in words. Try more to describe it in feelings, in emotions, in things you saw, in how it felt in your body, before you try to start describing the dragon that you saw, or the monster, or the divine light and love that you felt. So describe it in emotional terms. Describe maybe what you saw a little bit, or how you felt, or how the music affected you, or those sorts of ways. And then later down the line, over the next weeks or so, when you've really embodied as much as you can of that experience in a non-verbal way, to really try and engage with the experience in a complete way, then we start to talk about narrativizing it. What did you hear? What did you feel? What did the experience look like in a more cognitive way? So that's the advice we would give. People choose to follow that or not, because it's quite an exciting thing for them to go back and explain.
As far as the legal aspect of this is concerned, we have a question from Dr. Bhavya Bhansali that is it necessary to have had a psychedelic experience oneself to be an authorized practitioner?
Thanks for the question, Dr. Bhansali. I did cover this a little bit earlier, but as an authorized prescriber, technically you don't have to have had a psychedelic experience as an authorized prescriber, right? Especially if you're not going to be in the room with the patient. But authorized prescribers need to have had some sort of experience in psychedelic therapy. And to have experience in psychedelic therapy, it is highly recommended that you have a psychedelic experience. So indirectly, yes, but legally, from the TGA's point of view, no.
Thank God.
I think that I don't know whether anybody in the group has had a curated or an intentional psychedelic experience, but I would highly encourage everybody who doesn't meet the exclusion criteria to find a space, a legal space to do that, because it will change your practice as a mental health professional.
Yes, and I again want to remind that we have a couple of spots for that Portugal retreat that you are planning to have.
Yeah, I think that sort of a retreat is a lovely way for a mental health professional to engage in the therapy and really have a deep understanding of what it's like, what it feels like, and obviously for your own personal growth and well-being. It's a beautiful thing to do for yourself. Would be my take home.
We can wind up here, Anthony. It was a wonderful session with you, and we are looking forward to having the experience ourselves, and also to prescribe the same for our patients, and also for normal people who want to have the longevity benefits of it.
Yeah, I really hope that one day this medicine's available to people just for wellness and longevity, because there's a number of different benefits to it, even from the point of view of immune modulation. Psychedelics in very low doses are immune modulating, and Dr. Gabor Mate often talks about people with autoimmune diseases being cured after psychedelics, things like multiple sclerosis and ulcerative colitis. So there's a lot more to explore with these old medicines.
And when are you coming to India?
I've traveled so much in the world, and India's one place I've never been. So it's on my bucket list. I'm retired from a lot of my medical practice at the moment. So in the next couple of years, I would very, very much like to come visit.
I will be happy to host you here.
That's very kind of you, Divyam. I will definitely hit you up for that.
Thank you. Thank you. It was a wonderful session, and you have been liberal with the time as well. I had talked about 45 minutes, but sorry for overstepping on that.
No problem.
Thank you. Thank you very much.
Thanks, everybody. Have a great day.
Goodbye.
Bye-bye, Divyam.